So what brings you in today?
Well, I had an accident.
An accident, okay.
You know, I told you I have a dog.
Yeah, I do know that. Yeah.
And I know it's not a very big puppy, but still he's very strong. So I was walking him down the block and he saw squirrels. So of course he started jumping and running. So he pulled on my shoulder and I almost fell down and I hit my head as well.
Oh, I'm so sorry about that.
I did lose consciousness. So the neighbors helped me out a little bit, but I feel better now. But I just wanted to make sure that I'm okay.
Okay, sounds good. So I can definitely make sure that all your cranial nerves are intact. So you mentioned that you hit your head. Is it in the back right here?
No, it actually happened right here in the front. I don't know if you still feel the bump. Yeah, right here.
Oh yeah, I do feel a little bump right there. Does it hurt when I press
Yeah,
that?
it does.
Okay, I'm sorry. Okay. And he pulled on the leash and you also feel pain in your back?
I felt like my shoulder dislocated. You know, like it jumped out of the socket.
Oh my goodness, okay. So hit to the head and then shoulder pain. And on a scale of 1 to 10, how would you rate your pain on your shoulder?
Right now?
Yes.
I would say it's a 7.
A 7, okay.
Yeah.
Alright, so I would definitely like to check all your cranial nerves and make sure that everything is okay. And I would do a very thorough, detailed examination of your back and make sure that there's nothing going on with you that we should treat with medication or a treatment plan.
Sounds good.
Okay, I'm just going to put my gloves on and I'm going to ask you a couple of questions to assess your mental acuity. Do you know where you are today?
I'm in the doctor's office.
Okay. Do you know my name?
Dr. Lux, ASMR.
Dr. Lux. Very good. And do you remember what you had for breakfast today?
I think I had some feta cheese with salmon. Yeah.
Okay. Alright, so I'm going to just take your vital signs first to make sure that we have an accurate record of those. I'm going to listen to your heart, your lungs, check your pulse, your blood pressure. So just relax for me. I'm not hearing any murmurs, strong regular beat. I'm able to hear S1 and S2, not hearing S3 and S4. Okay, I'm going to listen with the bell side as well. All normal sounds. I'm going to focus on your lungs next. Take a deep breath in for me and out. Inhale and exhale. Inhale and exhale. Excellent. So I was not able to hear any crackling sounds or anything abnormal with your lungs. I'm going to check your pulse on your wrist. May I please have your hand? Just relax for me. Normal. I'm going to compare it to the pulse in your other hand. 2+ synchronized. All within normal parameters. I'm also going to check the character of your pulse over on your brachial artery. Not hyperdynamic nor weak or thready, so that's a normal pulse character. And I'm also going to check it over on your carotid artery. Just relax for me. Normal. Okay. Next up, I'm going to check your temperature. This is going to go over your forehead and behind your ear. 98.5, so that's a normal temperature. You do not have a fever. Let's check the levels of oxygenation in your blood at normal room temperature. And this is also going to give me a reading of your heart rate. 98% oxygenation, about 85 beats per minute. So very normal. I'm also going to check your blood pressure. Do you have an arm preference?
Yeah, I think I would like this one.
Okay, since this one hurts right in the back here. Okay, we can do this one.
Okay.
Okay, can you please hold this for me right there? And you can just put your arm right here in between my body and my right arm. And just relax. Okay, I'm seeing 130/75, a little bit elevated. It could be because of the pain that you're feeling.
Yeah, most likely.
Alright. Okay, Matt, so your vital signs look within normal limits, a little bit of an elevated blood pressure, but I believe that may be because of the pain. I'm going to palpate your head next and feel for any lumps or bumps. You can close your eyes and relax for me. And the pain is right here.
Yes.
Okay. I'm just going to check your head for symmetry everywhere else. So your head is symmetric. Do you feel any pain in the back of your head here at the top of your spine? Not feeling any lumps or bumps. Going to check your lymph nodes above your clavicles. And checking your jaw. Pressing down on your mastoid bone behind your ears. Any pain here? I'm not noting any lymph node enlargement. Just going to take a look at you and your shoulders. This one looks a little bit inflamed, but I'm not seeing any redness. And I can see it is slightly a little bit more elevated than your left one. Let's do a couple of range of motion exercises with your head. Can you please look down for me? Lower your head as far down as it goes. Any pain right there? No. And now, can you please move it back all the way back? Any pain right there? No. Now, can you please look to your left and turn your head left? Any pain? No. And right. Any discomfort right there? No. And can you please do a rotating movement with your head? Not hearing any clicking sounds or crepitus sounds. Very well. Okay, I'm going to check your shoulder next from the back. Not seeing any redness, just a little bit of inflammation. Does it hurt when I press down on your scapula in the back?
It does.
Okay. I will do some adjustments towards the end of our exam today to make sure that I relieve the tension that I'm hearing, the tension that I'm feeling right here in the back.
Okay.
Okay, Matt, I'm going to assess you from a neurological point of view. Next, can you please look at me? I'm going to just look at your pupils in normal light condition. I see that they are round, they have the normal size and shape. One of them is not bigger than the other, so they are symmetric. Can you please give me a big smile? And now a frown. Excellent. Now can you please puff out your cheeks for me? Hold them puffed. I'm going to try to unpuff them. Resist that. Very good. Now shrug up your shoulders for me. Does that hurt?
A little bit in the back, yeah.
Okay. And you can lower them now and relax them and shrug them back up again. I'm going to attempt to press down on them. Good, okay. So that is perfectly normal. Can you please lift up your eyebrows for me? I'm going to attempt to lower them. Resist that. Very good. I'm going to attempt to move your head towards your left. Don't let me do that. And now towards your right. Don't let me do that. Very good. I'm going to attempt to bring your head down. Don't let me do that. And push it back. Don't let me. Very good. So that's all perfectly normal. I'm going to focus on your eyes next and your vision. All right, can you please look right here? I'm going to check your pupil response. And from above, and from below, and over your eyes. And on the other side. So pupils are round and reactive to my light. Next up, continue looking at the tip of my nose. I'm going to move my left or right fingers. Tell me which ones you see me wiggling.
Right. Right. Left.
Excellent. Now can you please touch your nose and mirror me? Excellent. Now look, continue looking right here and touch my fingers with your finger. And now back to your nose. Touch my finger with your finger, back to your nose. Finger, nose, finger, nose, finger, nose. My left finger, nose. My left finger, your nose. Now with both of your hands, touch my fingers and now touch your nose. Excellent. Now can you please cover one eye and tell me how many fingers I'm holding up?
2, 5, 1.
Excellent. Now can you please cover the other eye and tell me how many fingers I'm holding up?
5.
Excellent.
1, 2, 1.
All right. Now we're going to do what's called the lid lag test. So I'm going to assess whether you have any lag in your eye mobility. Can you please look right here and try to keep your head steady. I'm going to move my hand all the way down really fast. Try to follow it. And one more time. Excellent. So I'm not noting any lid lag, which is a very good sign from a neurological point of view. Now can you please follow my finger, keep your head straight, look right here and just follow my finger. Any double vision right here or blurred vision? No. Try not to move your head. So your eyes are moving together, synchronized movement. Most excellent. Continue looking right here at the tip of my nose or at my eyes and tell me when you see my fingers escaping your field of vision. Yeah. Excellent. Yeah. Excellent. Yeah. Excellent. Continue looking right here and tell me when you see my fingers entering your field of vision.
No.
Very good.
No.
Very good.
No.
Excellent. Okay, I'm going to do a quick color test next. Can you please identify this color for me?
Red.
Red. Very good. How about this one?
Green.
Very good. This one right here.
White.
Excellent. Okay, I'm going to check your optical nerve next, just to make sure that nothing was damaged during your accident, and that your optic nerve and your cornea looks okay.
Okay.
Can you please look in the distance for me? I'm going to come really close and shine my light in your eye. Cornea is intact, no redness or swelling. Can you please look up for me? And down, and to your left, and to your right. Excellent. So that optic nerve in your right eye looks perfectly okay. I'm going to check the other one next.
Okay.
Okay, continue looking in the distance for me and relax. I'm going to come really close and shine my light in your eye. Cornea is intact, optic nerve looks normal. Can you please look up for me? And down, and to your right. Excellent, and to your left. Excellent. No abnormalities noted with your optic nerve, which is very good considering the fall that you had. Okay, I'm going to focus on your ears next. Have you noticed any ringing or any abnormal sounds in your ears?
No.
No, very good. I'm just going to feel and pinch up. Any discomfort right here?
No.
And pinch back and down. Any pain?
No.
Okay, can you please look to your left? Oracle of the ear looks normal. No external discharge. No signs of any external inflammation. I'm going to take a look inside with my otoscope. Normal tympanic membrane, well-defined borders, pearly gray color, and no signs of an inflammation or infection. Okay, I'm going to do the same over on this other ear. No external discharge or abnormalities noted. No redness. Going to check inside. No obstructions, no signs of any infection. Pearly gray color on your eardrum. And normal tympanic membrane overall with well-defined borders. Excellent. Okay, Matt, I'm going to assess your hearing next. Can you please close your eyes and tell me which ear you hear a sound with, left or right?
Okay. Right. Left. Right. Front.
Front. Very good. How about now?
Up. Front.
Very good. I'm going to use a tuning fork next. I'm going to strike it and cause a vibration. Tell me when you stop hearing it.
No.
How about now? Can you hear it now?
Yes.
Excellent. I'm going to repeat the same test on your other ear. Let me know when you stop hearing the sound.
No.
How about now? Can you hear it?
Yes.
Excellent. And can you please tell me if you feel this vibration?
No.
You don't? Okay. Let's try again. How about this one?
Yes.
Okay. So harder vibration you're able to hear, but not the more sensitive one. This is going to feel a little bit cold. Can you please close your eyes and tell me where I'm touching you?
Left cheek, right cheek, forehead, chest.
Excellent. And can you please tell me if this is sharp or dull?
Dull, sharp, dull, sharp.
Very good. So I believe everything checks out with the cranial nerves that control the movements of your face. Your hearing is okay. I'm going to focus on your nose and your mouth next. Okay, I'm going to check if your nares are patent. Can you please take a deep breath in through your nose and out. Exhale through your nose and deep breath in and out. Excellent. I'm going to evaluate the outside of your nose. Any pain right there?
No.
No pain. Any pain here?
No.
How about here?
No.
Pressing down on your sinuses underneath your eyes and above your eyebrows. Any pain right here?
No.
I'm going to test your smell next. Can you please tell me what it smells like?
Mandarins.
Very good, citrusy. And one more smell, very different from the first one.
Wood.
Wood. Very good. Can you please stick out your tongue for me? Pinkish color, well hydrated. I'm going to check the back of your throat. Can you please take out your tongue for me? No signs of any infection or inflammation. Normal gag reflex. Teeth are intact. Excellent. Let's test your sense of taste as well. I have here an essence. I'm going to drip one small drop on the tip of your tongue. Can you please identify this taste?
Cinnamon.
Cinnamon, very good. And I have here another essence, quite different from the first one.
Coffee.
Excellent. So I believe everything is okay with all 12 of your cranial nerves. I'm not seeing any signs of concern. I'm going to focus on your back, your shoulder next and see if I can give you some relief from the pain and the tension that you feel. Alright, Matt, so what I'm going to do next is a couple of range of motion exercises with your arms to let me assess the state of your muscles in the back as well as the front. So just leave your arm loose for me. I'm just going to move it for you. I'm checking for any clicking sounds or crepitus sounds. And all the way up and laterally forward and back down. So I'm not able to hear anything out of the ordinary. Let's do the same here. Just leave your arm loose for me. I will move it for you. And moving it all the way up. And laterally down. Excellent. I'm noting just a little bit of an inflammation over here. I'm going to evaluate the scapula in the back next. Alright, can you please move your arm like this laterally? I'm going to evaluate the scapula in the back. and down. So normal scapular movement, no clicking sound. I'm going to perform an adjustment. I'm going to press down on your scapula. Can you please look to your left and up? Take a deep breath in and hold for 5, 4, 3, 2, 1, and release. Excellent. Okay, let's try that again. One more adjustment. Take a deep breath in and 5, 4, 3, 2, 1, and release. Excellent. Okay, I'm going to do the same over here. Just evaluating the scapula first. Not noting any inflammation in the back. Lift your arm up for me, forward, laterally across, and down. Normal scapular movements in the back. Going to perform one adjustment. Take a deep breath in and look towards your right, and 5, 4, 3, 2, 1, and release. Excellent. And one more time, take a deep breath in, look towards your right, and hold 5, 4, 3, 2, 1, and release. Excellent. Okay, I'm going to evaluate your spine next. Any pain right here?
Yes.
I'm evaluating your cervical spine, which is straight. Going to tap on it gently. Let me know if you feel any discomfort. Your cervical spine is straight. Going to focus on your thoracic spine next, which is also straight. I'm going to tap down gently on it. And your lumbar. Going down towards your sacral spine. A very straight spine. Not noting anything abnormal on your skin, no redness, no scarring. Can you please tell me if you feel this on your left or right shoulder?
Right. Left. Right.
And where do you feel me touching you now?
Down the spine.
Down the spine. How about now? Upper back. Excellent. Can you please tell me if this is sharp or dull?
Sharp. Dull. Sharp. Dull.
Excellent. So you have perfect sensitivity in the nerves that control the muscles of your back. No signs of any concern. I'm going to listen to your lungs as well. Take a deep breath in and out. Take a deep breath in and out. Deep breath in and out. Inhale and exhale. And just breathe normally now. Excellent. This is going to feel a little bit cold, hopefully. I'm going to press down on your scapula here, on your right shoulder blade, to relieve some of this pain. Take a deep breath in and relax. I'm going to apply Kinesiology tape next. It's going to help stretch the muscle here in your back and warm it up and relieve some of the tension. Over on your left scapula as well, all the way across. This is going to really stretch out the muscles right here. I place the tape in a symmetrical way to hopefully relieve the tension equally on both sides of your back. Alright, Matt, so I did a very detailed, in-depth cranial nerve exam, a back exam. I performed a couple of adjustments. How do you feel now?
I feel great. The kinesiology tape just took the pain away.
I'm so happy that I was able to give you a little bit of a relief today. I'd like to see you back in about 2 weeks just to assess the state of your back and the bump that you have on your forehead and make sure that nothing escalates. Would it be okay if you came back around the same time in 2 weeks?
Absolutely.
All right. Very nice seeing you today, and I hope you'll feel better soon.
Thank you for being able to see me in such short notice.
My pleasure. Welcome to my clinic. My name is Dr. Lux, and I'll be taking care of you today. So I see that we have a 1 p.m. appointment for a head-to-toe examination.
Yes.
All right, you are a new patient, and I do have your chart from your old doctor, but I do want to confirm that I have the right information. Can you please tell me your first name and date of birth?
My name is Nicole, and I'm born on May 8th, 1999.
All right, Nicole. And when is the last time that you had a head-to-toe assessment done?
I don't even remember.
Okay, so more than 6 months ago.
Yes.
That's very good that you came to see me then. And do you have any allergies, Nicole?
Yes, I'm allergic to peanuts.
Peanuts, okay.
Yes.
And how is it trying to stay away from peanuts?
I have an EpiPen, so if I ever need anything, I'm fine. I've
That's
never had
good.
to use it.
You're prepared.
Yes.
That's most important. Any major surgeries?
No.
Are you on any medication right now?
No.
No medication. All right. Anything bothering you?
Yes, I've been having some stomach aches lately.
Okay.
I'm not sure why. I have some nausea with that as well, but also some back pain.
Okay.
I don't know why.
Is it your lower back or your upper back?
More my lower.
Lower back.
Yeah.
Okay. Any changes in your diet?
I don't think so.
No changes in your diet. Do you exercise regularly?
Yes.
Okay. How often would you say you exercise?
4 times a week.
4 times a week. All right, so let's go ahead and get you checked out. Going to go ahead and put my gloves on and we can begin the assessment, and I'll focus on your back and your tummy and see if I can find anything unusual that's going on with you.
Thank you.
Okay. And what I like to do is also assess my patient's mental acuity. Could you please tell me what day of the week today is?
Sunday.
Sunday. That's right, Dr. Lux works over the weekends as well. Very good. And do you know who the President of the United States is?
Yes. President Biden.
And do you know the Vice President name as well?
Yes. Kamala Harris.
Very good. Okay, so I'm going to go ahead and start by performing an examination of your head. And I'll be looking for any lumps or bumps, anything out of the ordinary.
Okay.
So go ahead and relax. You can close your eyes. And I'll just feel your head. Head is symmetric. I'm not feeling any lumps or bumps. Do you have any pain in the back of your head right here?
No.
The top of your spine?
No.
Any pain when I press down on your mastoid bone process?
No.
Behind your ear? No. Okay. Excellent. Okay, I'm gonna go ahead and perform a quick scalp inspection. I'll be looking for any abnormalities of the scalp, folliculitis, dandruff. Not seeing anything abnormal, no signs of alopecia. Hair distribution is normal. Normal hair distribution, color of your scalp blends well with the color on your neck and your face. Alright, let's go ahead and look on the other side as well. Okay, let's go ahead and check this side as well. Alright, all looking good. Alright, Nicole. So your head looks perfectly healthy, no signs of any concern with your scalp. You have a very healthy scalp. I'm gonna go ahead and focus on your face. I'm gonna just feel around and inspect it with my light first. So you can just look straight and close your eyes. And I'm just gonna feel for any lumps first, any tender areas. Do you feel any tingling?
No.
Not seeing any patches of dry skin, no abnormalities, no redness. No abnormal moles, no blues or purple colors, no scarring. Excellent. Alright, so just by looking at you in normal light condition, I see that your pupils are round. They have the normal size and shape. Body temperature is normal, no excess sweating. Your face is very symmetric. No signs of cyanosis or ptosis around your mouth. I'm going to go ahead and perform a facial sensations test. May I please have your palm?
Mm-hmm.
So we're going to do a test that's called sharp or dull. This is sharp and this is dull. I want you to go ahead and close your eyes and tell me if you feel a sharp or a dull sensation on your face.
Dull. Sharp. Dull. Sharp.
Excellent. And now I want you to tell me where you feel me touching you on your face. So keep your eyes closed.
Forehead and nose.
Very good.
Neck. Collarbone. Right forehead. Shoulder.
Very good. Alright, I'm going to go ahead and take a couple of measurements next of your face and the circumference of your head. You can go ahead and close your eyes and just relax. Can you lift one arm and hold it like this, elevated for me? 33.15. Okay, you can lower it, and now can you lift this other one? 28.5. Excellent. And of your eyebrows, 7.9. 7.5. And your mouth, 7.5. Alright, most excellent. Alright, next up I'd like to check your vital signs. I have here a stethoscope, which is a little bit cold, so I do apologize. Is it okay if I slide this under your shirt to listen to your heart?
Yes.
Alright. Alright, you can go ahead and just relax. I'll be looking for any murmurs. No murmurs, so no indication of any potential valve abnormality. I'm going to go ahead and listen with the bell side as well. I'm able to hear S1 and S2, not hearing S3 and S4, so no extra sounds. Most excellent. Right, I'm going to focus on your lungs next. Take a deep breath in for me. And exhale. Deep breath in. And exhale. Deep breath in. And exhale. Deep breath in. And exhale. Very good. I'm going to listen to the base of your lungs as well. You can place this hand over your chest like this. Take a deep breath in. And exhale. And take a deep breath in. And exhale. Most excellent. So clean, clear sounds coming from your lungs. No signs of pneumonia. When is the last time that you had a cold or you were sick?
Maybe 2 months ago.
2 months ago. Okay, so no residual extra sounds, nothing concerning. I'm going to go ahead and check your temperature. This is going to go over your forehead and behind your ear. And right here. 98.3, so perfect temperature, no concern for any fever. Let's go ahead and check your levels of oxygenation as well. May I please have your index finger?
Yes.
All right, let's slide it in here. Take a deep breath in for me. And just relax. I'm gonna count back from 5, 4, 3, 2, 1. 99% oxygenation, so very good. Your blood is well oxygenated and around 82 beats per minute, so your heart is very relaxed. All right, let's go ahead and check your blood pressure. Have you ever had this done before, Nicole?
Yes, I have.
All right. So we can go ahead and slide this arm in here and tuck it right in here. You can place it under my arm. Your legs are uncrossed. Can you go ahead and hold this up for me? And I'm gonna put my stethoscope. This goes right here. I'm gonna switch arms and just relax. All right. So 110/85, which is very good. I'm gonna go ahead and focus on your jaw next, your neck, and your thyroid gland. All right, so let me just palpate your jawline. Lymph nodes are not enlarged. Can you open your mouth slightly for me? I'm gonna go ahead and tap on your jaw. Let me know if you feel any pain. Okay. I'm gonna feel your lymph nodes above your clavicles. No nodules felt upon palpation. Clavicles are intact. Trachea is midline. Can you look up for me and swallow? Very good. thyroid gland is barely palpable, which is how we want it to be, not enlarged. Next up, I'm going to go ahead and perform an eye exam. You can look right at the tip of my nose, and I'm going to flash my light in your eyes. It's only going to be a couple of seconds. Right, look right here. From above. Oh. So pupils are round, reactive to light, no signs of any concern. Can you look up for me? I'm gonna go ahead and check the base of your eyes. Okay, very good. No signs of any jaundice, no popped blood vessels, which is a very good sign. So I want you to go ahead and close your right eye. All right. And I want you to tell me when you stop seeing my finger.
Stop.
All right, very good. You can just say now when you stop seeing it. All right, I'm gonna come a little bit closer. Go ahead and tell me when you stop seeing my finger.
No.
Very good. Now go ahead and cover your other eye and look at the tip of my nose and tell me when you stop seeing my finger in your field of vision.
No.
Very good. And a little closer.
No.
Excellent. All right, now I want you to look at the tip of my nose or in between my eyes, wherever is most comfortable. And just relax for a second. Okay, your pupil is reactive. Now I want you to look right here at the light and try to keep your head steady and just follow the light. Any pain right here as I'm stretching those eye muscles?
No.
No? Okay, let's see on the other side. Any pain right here?
No.
How about up here?
No.
And down below?
No.
Most excellent. Now I'm just going to move the light in all 4 quadrants and see whether your eyes are moving synchronized, in a synchronized way, or whether there's any skipping or lagging. Most excellent. So perfect eye mobility. Now I want you to continue looking in my eyes, at my nose, and tell me which fingers are moving. Your left or your right?
My left.
Your left. That was your right. This is my right. Very good.
Right. Left. Both. Right. Left. Both.
Very good. Excellent. Right, next up I want you to continue looking in my eyes. So don't break eye contact. Touch your nose. And now I want you to continue looking in my eyes, and with that finger that you're touching your nose, I want you to touch my finger here. Don't look there though, continue looking in my eyes. And now back to your nose. Touch my finger again, touch it, touch it, touch it, touch it. Now put it back to your nose. And continue looking in my eyes. Touch my finger, back to your nose. Touch my finger, it's a bit harder out. Touch your nose. Touch my finger down below and your nose. And now touch both of my fingers and put both of your fingers on your nose. Very good. Most excellent. All right, so we're going to go ahead and perform a vision test next. I want you to just turn slightly, and this is about 2 arms length. Can you tell me what letter this is?
E.
Very good. And this color over here?
Orange.
Oh, is it orange?
Red.
It's red. Good. And how about this color over here?
Green.
Green. And can you read this line over here starting from the last letter?
CETOPFED.
Excellent. Can you cover one eye for me now? And can you read this line, the second one?
FP.
And what letter is this?
Z.
How about this one?
NT.
And what number is this?
6.
And how about this letter all the way down here?
Oh,
Very good. Can you cover the other eye? Can you tell me what color this is?
red.
Red, good. How about this one?
Great.
And what number is this?
2.
And this big letter here?
E.
And this one here?
D.
Excellent. All right, so definitely 20/20 vision. Well done. All right, Nicole. Next up, I'd like to perform an optic nerve assessment. So I want you to just look in the distance, and unfortunately, I'm gonna have to flash another light in your eyes, only for a second though. Okay, so keep your eyes open, look in the distance, and let me take a look at your cornea. Can you look up for me? Left, right, and down. Excellent. All right, so optic nerve is intact. I'm not seeing any scratches or cornea tears or detachments. I'm gonna do the same on the other eye. All right, let's go ahead and assess your other eye as well. Continue looking in the distance for me and just relax. Can you look up, down, left, and right? Most excellent. So nothing concerning, no popped blood vessels, and your optic nerve and disc look intact. All right, Nicole, next up I'm going to inspect your ears, and we'll do a couple of hearing tests as well. Have you heard any ringing sounds or any abnormal sounds?
No.
No? Okay. No tinnitus?
No.
Any chronic ear infections that don't go away?
Not since I was little.
Not since you're little. Yeah, I also had those when I was little. All the
All
time.
the time.
Yeah, it's bad. Right, I'm gonna go ahead and look in this ear. You can look towards your left, and I'm just going to assess the outside of your ear auricle. No discharge. No signs of any infection on the outside of the ear. Does this hurt?
No.
How about this?
No.
When I pull laterally?
No.
Alright, most excellent. Okay, I'm gonna go ahead and assess your tympanic membrane. Just relax. No wax buildup. Tympanic membrane looks intact, pearly gray color. Well-defined margins. No signs of any no signs of any fluid buildup, and no infection. All right, let's see the other ear as well. All right, let's see this other ear auricle. No abnormalities noted externally. Gonna go ahead and look at your tympanic membrane. Well-defined margins, pearly gray color. No signs of any infection. Most excellent. All right, Nicole, next up I'd like to check the sensitivity of your ear. Can you tell me if you feel this?
Yes.
All right, a little bit ticklish?
Yes.
Okay, that's good. That's what we want. And let's check over on the other side. Do you feel this?
Yes.
Ticklish again?
Yes.
Very good. All right, let's go ahead and do a hearing test. You can close your eyes and tell me which ear you hear a sound with, left or right?
Right. Left.
Okay, and now can you tell me if the sound is moving further away from you or getting closer to you?
Closer. Closer. Closer.
How about now?
Farther. 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 Closer.
Excellent. All right, so no signs of any concern with your hearing. I'm gonna focus on your nose and your mouth next, and then we're gonna take a look at your tummy and your back. Have you noticed any abnormal smells, any loss of smell?
No.
No. Do you have allergies?
Just seasonal
Seasonal.
and peanut.
And peanut allergies, yes, you told me at the beginning, that's right. And when you get the seasonal allergies, do you have a lot of discharge in your nose usually?
Mostly my throat.
In your throat, yes, I get the same thing right here. Does it go away?
Yes, I take Claritin or allergy medication.
Okay, and that works. That's good. I have a lot of trouble with those usually. It doesn't work for me, so I struggle a lot during the springtime.
I'm sorry.
Yeah, I
I
know.
feel you.
All right, let's take a look at your nose inside. Can you look up for me? And I'm gonna just check your nose and the other nair. Okay, no obstructions noted, no discharge, no abnormalities. Very good. I'm going to give you something to smell. This is an essence of a smell. And I want you to close one of your nairs. And let's see if you can identify the smell.
It smells like Oreos.
Oreos, very good.
Thank you.
All right, I'm gonna go ahead and give you another smell. We have a lot of essences here in our practice. We get them all over the world and they're very unique. Can you close the other nair? Let's see if you can identify this one.
Lavender.
Lavender, most excellent. Comes all the way from Holland. All right, I have one more smell, and this time I want you to not obstruct any nairs. This one is coming from Australia, so let's see if you can smell this one.
Coffee.
Very good, Australian coffee. All right, I'm gonna go ahead and check your mouth next. Can you open your mouth for me? Just gonna take a look inside. Good teeth. Can you stick out your tongue for me? Pinkish color, well hydrated. All right, let's take a look in the back of your throat. You can just stick out your tongue for me and say ah. Excellent. No signs of any inflammation or infection in the back of your throat. I'm going to give you something to taste next. And this is also a very special essence that comes from Romania. Let's see if you know what this is. Stick out your tongue.
Orange.
Orange, very good, Romanian oranges. Romania exports a lot of oranges, so yeah, good. And I have another essence for you. This one comes from Turkey. Stick out your tongue.
Tastes like pancakes.
Pancakes, awesome, so well done. No signs of any concern with the cranial nerves that control your 5 senses. So I checked your eyes, your ears, your nose, your sense of smell, sense of taste, and sense of touch. So the sensitivity on your face was okay. I want you to go ahead and lay down so I can take a look at your tummy.
Okay.
All right, Nicole. You can just relax and close your eyes. I'm going to focus on your tummy, and I'm going to begin by doing a light palpation, and then I'm going to listen with my stethoscope to the sounds that are coming from your internal organs.
Okay.
Is it okay if I put your pants just a little bit down?
Okay.
All right. Just like that. And can you show me where the pain is that you mentioned?
Around here.
Okay. Just a light palpation to begin with. Gentle. Don't want to disturb any homeostasis that may be going on. I'm feeling for any lumps or bumps. And assessing the size of your internal organs. Stomach, liver, okay. I'm going to perform a light tapping percussion. Tell me if you feel any pain at any moment.
A little there.
A little right here.
Yeah.
On a scale of 1 to 10?
4.
A 4. Okay. When is the last time that you worked out?
Yesterday.
I'm going to use my stethoscope next, so it could be a little cold. I do apologize. I'm hearing normal swooshing and gurgling sounds, normal organ activity. I'm going to check your right quadrant as well. Right lower quadrant, left lower quadrant, left upper quadrant, all normal sounds heard in all 4 quadrants. No signs of any concern. Does it hurt when I press down?
A little.
A little more than when I don't press?
Yes.
Alright, so nothing concerning. I'm gonna go ahead and pull your pants back. And I want you to lift your left leg and try to bring it towards your chest. Does this hurt?
No.
No? Oh, okay, that's good. Alright, I'm gonna focus on your legs next. Alright, I'm gonna go ahead and just lightly palpate your legs. Check for any sign of edema. Do you feel any pain right here?
No.
Very good. No indentations around your ankles. Good, no signs of any edema. Just taking a look at your foot, normal color, normal skin temperature, no excess sweating. I'm gonna check the pedal pulses. 2+, synchronized. Capillary refills within 2 seconds, which is normal. Gonna check the other foot as well. Capillary refills within 2 seconds. Alright, let's take a look at the plantar region over on your right foot. Just doing a light palpation. Let me know if you feel any pain. Okay, no pain noted. Let's assess the foot from a neurological point of view. We're going to do the same sharp or dull test. Keep your eyes closed and tell me if this is sharp or dull.
Sharp.
Good. How about this?
Dull.
And this.
Dull.
And this.
Sharp.
Very good. Most excellent. And can you tell me what kind of sensation is this?
Cool.
Alright, and where am I touching you right now?
The arch of the foot.
Very good. So neurologically everything checks out with this foot. I'm also going to do the Babinski test. Negative Babinski. Most excellent. Alright, let's take a look at this other leg as well. Just checking for any edema signs. No indentations around the ankle. Any pain when I press down on your plantar region?
No.
Very good. Alright. Keep your eyes closed. Is this sharp or dull?
Sharp.
How about this?
Dull. Sharp. Dull.
Excellent. And what kind of a sensation is this?
Cool.
Most excellent. And finally, going to close out with the Babinski test. Okay, one more time. Negative Babinski. All right, most excellent. Can you tell me if this is painful?
No.
How about this?
No.
I'm going to attempt to spread your legs apart. Don't let me do that.
Mm-hmm.
I'm going to attempt to bring them together. Don't let me do that. Excellent. So everything checks out with your legs. Going to pull this back and you can come back up. Alright, Nico, so I took a look at your tummy. I assessed the state of your muscles in your back when I arched your foot. I took a look at your legs and your feet. I'm not able to notice anything abnormal, but I do recommend that you come back for a back exam and see if we can go a little bit more in depth with an investigation.
Okay.
Very nice seeing you. Thank you for allowing me to do this exam on you, and I'll see you back again soon.
You too. Thank you.